So we'll do today a small demo on the event-based information system we have been working in these recent years. And for that, we have chosen a simple scenario, and then I'll jump to the software. So can I share the screen? Yes, I think. Am I allowed?
You should be able to.
It will be based on a scenario where a public when the public informs the public health authorities that himself and his family members feel sick since yesterday with fever and diarrhea. And then it goes to this district epidemiologist of Hasi, who get notified by the system and contacts the reporting person to verify the health event. And it learns that the person which is not feeling well has been in a wedding ceremony in another district, into a restaurant, and then it reports back to the system. The Institute of Public Health, which is the central epidemiological headquarters, receive the information and assigns also the other district, like the Toropoia district source, which was the wedding restaurant. And then and checks the restaurant and find out more. I don't know if you followed, but let's say the district A informed the public, the public informed the district, then the district checked with the public and find out that the source was into another district. The Institute of Public Health received the information and assigned the event verification to 2 districts. And then they can go from an event to a confirmed cases and start the case-based investigation, and then connect cases through a line listing into an outbreak investigation. So that's integrating an event-based system with an indicator-based system into a single platform. So that's the basic concept of the scenario. I'm going to show you the system itself. Let's say this is the web page where the public would go and report an outbreak. And I'm switching in English.
Thank you.
Yeah. So the event reporting, it's very simple form. We keep it ourselves very simple because it needs the purpose just to get a message from the public and not to go into very details, because the verification phase would go into details and asking questions and so on. So first it starts by putting the name and then describes that my yesterday. And then he says, in the municipality of Hasi, which is one of the districts, and if needed, it could be also assigned a village if he is from a village. So the location, we have geographical coordinates for both at district center, but also for each of the villages in Albania. So this automatically, when you choose one of the villages, we can map it out later on in the export of the data. So this is more than enough to require. However, only 3 fields are required by asterisks. As you can see, it's the name, the phone, and the description of the event are required, because the phone is needed to call back from the epidemiologist to ask for more information. And then the public can record the event and push it through. Now, I'm going to enter in as the district epidemiologist, district A. The first district which was selected there. So I'll get in the system and enter in the system as district. Now, sorry about this. Yeah. So here you'll see the last events in the 10 days. Okay, so this is where the messages comes. So the district epidemiologist can see it within the system in red, that a new event has been reported, but it also can get an email in his inbox with the content of the event. And he would go here and open the event tool that he has in his disposal. And if we see here the categories of the information, let's say the epidemiological service of this district, the registration channel, so the information source, it's via web, but it could be via SMS, it could be also in future via Medicis, so media screening and so on. So it could be different sources of information. It could be also from another district or from another public institutions which got access in the SECID system. But in this case, we are only talking from an event reported by the public to the web page of the system. It says what's the subject or what's the problem occurring or what's the event reported. It's the date when the event is reported here. As we said, the source, it's public. It could be newspaper, it could be other TV, radio, and so on. Then the place where the thing occurred is the district of Has, then the village of Bardai. And then the access, it's limited here, but it could be also for all. It depends by the nature of the investigation he's performing. He can open access to all the other users in the system or could keep it limited to his district only. And then it's the reporter name, who reported the problem, telephone connection, and so on.
Kujtim.
Yeah.
Can I just jump in? Sorry, because there are a few questions about people do not understand if you access now as the public. I mean, people can access the system, or this is what you see from your side as a, let's say, head. Sorry.
The public had only this bits. Report the event. So the public sees only this. It has only a reporting form. And then the district epidemiologist has this one. So now he received the information. It's the district epidemiologist which received this and has this interface. This is an interface for the district epidemiologist. And he goes out and takes, checks out if the event it's really a thing or not, or so. He verifies it, he checks it out. And he could go and say here and puts his response and say, the Hasi Epidemiological Service goes there, contacts the person and find out that he participated in a wedding in Propoia district. And then he says that the status is in process, it's not complete, and updates this. And this information goes in this checkbox here. Now, this is what a district does, the district which received the information. If we go now to the Public Health Institute, now the Public Health Institute . the Public Health Institute goes and checks that the new event has been dealt by the SECID district. So the event which we are talking is this one. It's this top row. And it's in process. So it's in the process of being verified. And the public health opens a similar pane here, a similar interface, and goes and check what HASI said. And it sees that it's not only in HASI, but it's also in Tropoia. So it's another district involved because the source of the event, it's not in HASI, but it's in Tropoia. So what the public health can do, it's assign here also the Tropoia district epidemiologist services. So now this event is being checked out by 3 epidemiological entities, which is the HASI, which is this first one, the first district which received it, and then the Tropoia, which is the source of the event. So it links different services, epidemiological services, to each other into the same page. So it's a joint investigation. This was done by purpose, so people would work peer-to-peer and not hierarchically only, but it would have a horizontal kind of a structure to investigate or to verify events. So that's the purpose of having multiple actors involved into it. In future, we'll have also the veterinary involved in here when we'll have to verify events which pertain to animal health or environment and so on. So the Institute of Public Health updates this, and it's done as Public Health Institute. Now the second district which was involved, I'm entering there as a second district again. So I got here in the events location, and I see that I'm the second district now involved, and I see that this event, which is based on this family sickness into HASI, now it has two epidemiological services involved, District 1 and District 2. And then I go here in my District 2 so I can, as District 2, I cannot change, as you can see, this is change the source of information because I am a district which I'm receiving this information. I can only add what I do in my own district here in Tropoia. So I cannot change the source information because it came by the public and it was assigned to me as a district to check what's going on. So I go here and I put my own thing and I say, is it at the Albania restaurant and find out that 3 more cases had see their symptoms. And suspicion for salmonella. from my end as district epidemiologist, since I suspected for Salmonella, I say I complete my verification of the event, and then I'll say start an investigation here. So this is starting the investigation, or it's not an event, it's a case, or start an investigation. So I'll start a formal case-based investigation. And the date of my completion of this verification is this, and I'll update and close the deal as the second district. So this is what I did as a second district. I verified my case and I said, I'll start the investigation. The same can be done by the first district. This is the first district. It has to close also, him has to say in this that we close it as well. It's complete the verification. We will start an investigation as well in our district, and then updates.
Kujtim, this is Jay. Can I cut in real quick?
Yeah, it's finished. That's all.
Okay. Then this is perfect timing. This is perfect timing. I was going to say one that you've got 3 minutes more, 4 minutes more like.
Wrap it up. I mean, it's we get a notification. We have the district responsible. If the event pertains more than one district, or it's widespread or whatever the nature, it's not only related to Salmonella like this case, it could be anything reported. If it's the geographical scope, it's more than one district, then we can involve more than one epidemiological services from the district. So we can do this horizontal linking between different actors. In future, we will add also vet and also the environmental people. The system operates only for medical human epidemiology, but the plan is to expand to veterinary. Both districts or all the concerned parties has to close their verification process, and when they close this verification process, they can start case-based investigation, and from case-based investigation create line lists and go to an outbreak, full-scale outbreak investigation, which then it's not anymore on the qualitative side like it's the event-based, but it goes more on quantitative side of investigation types, indicator-based. So that's all for this this module. If you have questions later on, we could talk in details if you wish.
Okay, Coach Tim. So just because people have some questions already that are very specific to your presentation. So thank you for the presentation. I love that you used something that we could all identify with. So like a food poisoning event, Salmonella. I love that you used that as a case study. I happen to know that you do have a so some of the questions that have come up that I can see is one, if you have an output dashboard component where you can show like a report summary. I do see that's in the chat box, and I do see that Sylvia, she already answered saying that you're working on a summary dashboard, but then that you do have a summary report. So do you want to touch on that very briefly?
We are developing currently a One Health dashboard, which would have all statistics, visualization, mapping, reporting, and so on. Currently, we have a data export here. So we export data in Excel or CSV or whatever different format, and we can analyze the information. There is no visual dashboard here embedded as yet. So it's more collection and data management tool, and also organization tool between different actors. at the time being. But we are
Awesome.
we will have full-scale visualization, maps, and charts and connections between different surveillance systems interlinked into this kind of analysis that it's needed, because we are trying to integrate both, as I said, event-based and indicator-based, and that would be reflected also in the visualization.
Awesome. Awesome. Thank you. So the other question that's come up in the chat, I happen to know the answer to that question, and Sylvia has provided an answer. But just so you can talk about it briefly, is the question asking how have you used this system during the COVID pandemic? So can you share very briefly in 1 minute how you've used the system during this pandemic?
It was the backbone of disease reporting, basically, because the system is not only event-based, it's a full-fledged epidemiological information system. So here we see form notification. I don't know if you see it in the screen. Form notification is this one. And I can open here. And then here it's full what people reported COVID and so on. This is the screen. And we can add a full record here, and then. So people did report all cases of COVID has been reported in the notification form, infectious disease notification form, and all cases did, this is analysis answers, but this says laboratory diagnostic, because the system is linked to the laboratory information system as well. So we can connect cases with laboratory samples into this. And then we have investigation for each of the cases. And I can just one very shortly, an investigation form. So the investigation form has the inquiry here, which basically says investigation, but the translation is not. So the information of the patient in a tab, there it's clinical science, it's epidemiology of the disease, where did contract it and so on, vaccinations, if there is any vaccinations, laboratory information, contacts of the person, and it could be contacts in forward and in backward, so contacts which can infect the person or people which got exposed to this case. There are measures taken, and then you could also upload documents which are related to this case. So this is a case-based investigation for COVID. So it was extensively used. The response is it's extensively used for COVID.
Awesome. Thank you for your answer, and thank you for your presentation. And thank you for the questions in the comments too, Sylvia. I see you in the comment section responding to to questions. That's perfect. One of the things I want to point out real quick before inviting Cambodia to jump into their own presentation. One of the things I want to touch on, one of the things that you could see in the Albania presentation is that, that they keep a track of dates. And I want to say that that is very, very important because one, like when you start thinking about the evaluation piece, how do you evaluate your system? Is your system working as designed? And then how well is it working? So you being able to say, well, this outbreak started on this date. This is the date it was verified. This was the date that it was that we started responding to it. This is the date that we started measures for that outbreak. So dates super important when it comes to this. When it comes to these systems, I saw a question that came up, which I did not feel was a question for Albania specifically, asking, can we use this online system here in Pakistan? And the answer to that is no. Why is it no? Because these are systems that you're building, they're unique to your use case. So this was a system that was designed and built by the Albania team for Albania to meet their own needs. And again, circling back to what I said at the beginning, but not.
Can I just interfere, because this could be helpful for the Pakistani. The software, it's open source, and it can be, as you see, it can be translated in different languages. Like I switched to English or switched to Albanian, switched to Pakistani, whatever. So if they would wish, we could connect them to the development company, and they could just adapt to or customize to their need, because it's open source. It's not costing a lot. It's just the cost for the customization. It won't be breaking the bank, let's say. And that's the purpose. We build it open source, having in mind that other people might find interest in such a software and adapt it and to their current situation and use it. So that could be in future. I mean, we didn't finish developing yet, but when we will finish, it would be for everyone then. Thanks.
Awesome, thank you. And so the key piece there is the customization. So it needs to meet your country use case, and the use cases for each country, they will be different.